But let's turn to the story that's breaking right at the top of the news today. The Uttar Pradesh government of Yogi Adityanath has become the first government to clear a law or an ordinance on love jihad or so-called love jihad. The ordinance says it will fight alleged love jihad. The law seeks to punish marriages that are done through fraud, conversions by fraud or through fraud for the sake of marriage will now attract up to 5 years in jail. Conversions after marriage will need the DM's permission. This is the new ordinance passed by the Uttar Pradesh government. Remember, several BJP-ruled governments have been saying that they will pass laws against alleged love jihad. Uttar Pradesh now has become the first government to pass a love jihad law, or the law which is named as the Prohibition of Religious Conversion Law. Joining me now right at the very top is Senior Uttar Pradesh Minister of the Bharatiya Janata Party, Siddharthnath Singh joins me. Siddharthnath Singh, how do we describe this law? Is this a law against love jihad, or what you call love jihad, or the Prohibition of Religion Conversion Law? Let's get it very clear. What exactly are you seeking to achieve?
Well, it's a prohibition of unlawful activities which are being happening in many parts of India, but since we are referring to Uttar Pradesh, but in Uttar Pradesh also, and therefore this was something which even the High Court, Allahabad High Court took notice of, and they also spoke about it. And we have brought an ordinance so as to ensure there is a law and order, and there is issues which are forceful conversions or portions are there, allurements are there. All these cases which get reported are then strictly followed as per the law.
Okay, but Mr. Siddharthnath Singh, Article 18 of the Constitution says everyone has the right to freedom of thought, conscience and religion. This right includes the freedom to change his or her religion or belief and freedom. I want to understand, how does this law fit in with the constitutional right of any individual to practice whatever religion or marry whoever he or she wants?
Well, you also know, Rajdeep, that the Constitution also protects that you will not be forced by anyone for conversion. So forceful conversion is something which is not allowed as per the Constitution. Therefore, what we have seen, despite that, there have been cases, many of them which are being reported, and in that case, you do need a special law to protect particularly under the forceful religion conversions that are taking place. So there you do need a special kind of a law which has been brought in.
No, you're saying you need a special law. Under the law, my question is, what is the need for the law? Because already, let's assume, sir, there's conversion through cheating or force. Section 420 of the IPC provides maximum 7 years jail for cheating. So therefore, you could have gone under the existing laws. What is the need for this? Critics are saying that this is an attempt. Critics are saying this is an attempt to prevent interfaith marriages and in a way a dog whistle to target minorities. What is wrong if a Muslim boy and a Hindu girl marry?
That's been, Rajdeep, that's been always the case. Whenever BJP brings something, they always say, oh, it is anti-Muslims, it is communal, all these things we keep hearing. But at the end of the day, we do also know there are many cases which are being reported, despite the law being existing, that there has been a forceful allurement cases are happening, portions are happening, people do come to know about the religion and then they are punished if you do not convert. So all these things do get reported. So you do need a better law to protect that. That's all. So India does have many laws, we also know, but all the laws do need certain changes with the time to come, and certain things have been observed. So you do need to improvise and improve upon it.
No, the worry, Mr. Siddharthnath Singh, and this is true with various laws, is the ample scope for misuse and the excessive powers that it confers on the police force, for example, the local police, to in a way arrest any individual. I just want to understand, are you all aware, where are the safeguards in this law? The worry about the law, what is the safeguard? Please tell me the safeguard.
That's exactly what we have looked into very carefully. Someone who are emotionally attached and they are adult, they need to, and the girl agrees to convert. So there is a provision that you can go to district magistrate before conversion and give an application, and district magistrate will dispose of that frame, very short time frame, and you can convert and you get the protection under the law. You can even, there is a provision which has been brought in that yes, you tomorrow you get married, you do convert, but then within a time frame you go to the district magistrate, give an apply post conversion, and within a short time period you do, then all the hearing is done, and then she is given the protection. So all those provisions have been brought in so that the misuse doesn't happen by the law enforcement agency. The misuse doesn't happen by false representative or fraudulent practices.
Are you, at the core of it, are you saying that you all have no faith in young women? I'm not talking about a 15-year-old, 16-year-old, a minor. I'm talking about 19, 20, 21-year-old women who of their own choice may fall in love with another man from another community. The question is, at the end of the day, do you believe that this crime, and I use the word crime, is so widespread, of cheating and inducement and falsification of identities, that it needed a separate law? That's the question.
Yes, certainly.
Did it really? Is it so? Is it really so widespread?
It's not. Yes, it is getting widespread. That's exactly. I'll give you a case. I'll read it out to you. Abdullah creates a Facebook ID with the name of Aman Chaudhary. Abdullah uses a wig to trap a minor girl. He kidnaps her and rapes her. When police caught him, they found that he already had 3 wives and 4 kids. That's happened in Meerut. Should I give another one to you?
No, but that under IPC, sir, under IPC, sir, under IPC, a case like that could have been easily resolved.
No,
why do you need a separate
it's
law?
all bailable. That's exactly what you're unable to understand. If it is within, the punishment is within a 7 years, it's all bailable. It's a non-bailable offense that we have brought in under the ordinance. So there is a provision which has been brought in which is harsher than what it was existing. The idea is always under a law is to bring a law is to become a deterrent. The idea is deterrent, not to punish unnecessarily. But and there are problems in the community which happen just because of this. So there are issues. Therefore, a law which was existing, but it wasn't a very special focused one. It has been brought together with a harsher conditions and more specific towards it.
You know, the reason I'm also saying this is because you're giving instances, but in response to a question in the Lok Sabha, the Centre on February 5th, 2020 admitted that the concept of love jihad was not officially defined under existing laws. Thus, no such case has been reported by the central agencies. I'm trying to understand, therefore, are you saying now that after February 2 compared to November, the situation has so dramatically changed that you need this law?
Well, you are referring to the State Minister.
Yes.
He may have referred it in the definition of love jihad. Love jihad is not a definition which has been brought in. It was something which was used in 2009. Now, that definition he may be defining. I can't really answer for him because what was the question? But yes, there are cases, and the cases are there which have been reported to the police. There are cases which have gone even to the Allahabad court. And therefore, the Allahabad High Court, the judges have reported it and spoken about love jihad. So it's not that something that we have come out of box or created just for the heck of it.
No, you're not worried that it will disrupt communal harmony on the ground as is being suggested by the Rajasthan Chief Minister Ashok Gehlot?
The problem, Rajdeep, sorry to say, but the problem has been that the communal harmony was already being disturbed because of this forceful act, but people call it a secularism. Now today you bring a law to strengthen it and so that it doesn't happen. Something was already happening. Something was already taking place and there was a communal tension happening because of it. Now you step forward to control it. That is being called communal. I can't really understand this.
Sir, I'll tell you what, Chief Minister Yogi Adityanath a few months ago or a few days ago had used the Hindu funeral chant, Ram Naam Satya Hai. He had said, we will bring an effective law. It is my warning to those who play with the honor and dignity of sisters and daughters by hiding their real names and identities. If they do not mend their ways, their Ram Naam Satya journey will start. My worry is this not, this entire law is coming at a time when there seems to be an element of threat, an element of sort of hatred. That's the worry. Nobody's saying you cannot act against any case of cheating, fraudulence, but the atmosphere that has been created somehow is Muslim men are somehow or the other trying to induce Hindu women.
Well, let's go back. Let's go back and rationally think about it. The Yogi Adityanath ji mentioned this, which is true, but it was mentioned after the Allahabad High Court. They took notice and spoke about it. And what he said is absolutely right. So walk the talk. He said, yes, I will bring it. And he's brought it. So this is something to protect and bring more harmony towards it. Why should one be looking at it in a different way?
Sir, I've just got from a top lawyer, and he's just told me, please tell Siddharthnath Singh that cheating is also non-bailable and cognizable. So you already have an offense under existing. My point is, what is the need for a new law?
It's the tenure. I'm not a lawyer, but it's the tenure which is less than 7 years becomes bailable. If it is beyond 7 years, the cognizance is taken, it becomes non-bailable, it's not easy to get a bail. So there is a deterrent towards it, something which if you say it was existing was not good enough to stop this activity of love jihad happening in the country, in the state of Uttar Pradesh. So it's something which has been done to bring harmony in the community, to bring freedom of religion also. You can't force. Rajdeep, I will give you more cases if you wish to. Sonbhadra, I'll give you another case from Sonbhadra. There are so many cases where the girl has been cheated. She has been given a Hindu man's name. Then she finds out and then she is forced. There are cases which relates to even IS, where she has been asked to convert and work for IS. So there are a number of cases which have been reported. So let's not say that it is something which is being done just for the heck of it, for political reason. There are many examples in the state of Uttar Pradesh and in India, which is certainly creating a communal tension.
Siddharthnath Singh ji, you come from Allahabad. Today the Allahabad High Court reiterated persons' right to live with people of their choice irrespective of religion. The court was hearing a petition filed by a couple, Salamat Ansari and Priyanka Kharwar, who tied the knot on 19th August 2019. So the Allahabad High Court is very clearly saying it's the right people's right to choose. I want to choose to marry anyone. You can't decide. The government. Why should the government decide?
Government is not stopping. Government stopping.
So if the parents of the girls, sir, I'll give you an example. You're giving me example. What if the parents of the girl?
Rajdeep, please explain to me where in the ordinance the government is stopping.
Sir,
government is not stopping.
Sir, the fear.
Government is saying. The fear is what? The government is not stopping. They are actually protecting the right of religion. By saying that please go to the DM, if you want to convert, do convert. Let all the pressures of the society be there. But if you two are adult, you want to convert, go rightfully, convert, and there's no problem after that.
I'll tell you what
the government is saying.
Sir, Siddharthnath Singh, I appreciate that, but I'll tell you what the practical problem is. The practical, let's say the girl's parents are against the marriage. They will tomorrow then use their influence in the local community or with the administration or with the police to have the man arrested. And with these stringent provisions, the man will be perhaps helpless. That's the worry. The scope for misuse is the worry, sir.
Where is the misuse? The misuse can be the otherwise also. Those people who are well connected can still be doing it. So let's not go. There is those two people can go legally to the district high court. The district magistrate, and nobody else will dispose of. But the district magistrate will dispose of the case. This is a senior officer, an IS officer, and from there they get the protection. So there is a provision which has been brought for a protection. Those who really want to, have a marriage, and in that marriage you want to convert also.
The final question, and I want to just ask you this to get complete clarity. There is a sense that this law is focused at the end of the day on the whole issue of conversions. Is it conversions for the specific purpose of marriage itself? Or are you somewhere or the other sending out a signal that the government of Uttar Pradesh is against inter-religious marriages?
No, certainly not. It is not that there people, we are against the inter-religion marriage. There are two adults, you want to get married, there is a way you should go so that there is no tension in the society. Even anybody complains about it, two adults have agreed about it. So there is a protection given by the government. At the same time, it is very enshrined in the constitution that people can convert, but you cannot have a forceful or a cheatful or allurement or fraudulent basis of conversion. So that's what something is there, but that's been given a special provision under and given a special teeth.
Okay. We'll leave it there, Siddharth Singh. You are insisting, you're defending the law and saying that you have enough safeguards to prevent its misuse. The critics will continue to say that this is some kind of a dog whistle that is targeting minorities. Two views. I appreciate your joining me here at the top and explaining the government's position. Thank you very much, Siddharth Singh of the Uttar Pradesh government there on the new law, prohibition of religious conversion law of so-called love jihad. Let's turn from there to an issue that should concern each and every one of us, because the country is slowly preparing for a COVID vaccine distribution plan. Today, Prime Minister Narendra Modi met chief ministers and outlined a rollout strategy at a crucial COVID review meet. However, serious questions still remain over the pricing of a vaccine and, importantly, about a timeline for it. Let's take a look.
करीब करीब आखिरी दौर पर वैक्सीन के में काम पहुंचा है। भारत सरकार हर डेवलपमेंट पर बारीकी से नजर रखे हुए हैं, हम सबके संपर्क में भी हैं।
With the race for a vaccine against coronavirus entering the last lap, the focus is now shifting to putting a vaccine distribution system in place. In his meetings with state chief ministers on Tuesday, Prime Minister Narendra Modi warned against party politics over vaccine and asked them to get ready with a battle plan.
केंद्र सरकार ने राज्यों से कुछ समय पहले आग्रह किया था कि स्टेट लेवल पर एक स्टीयरिंग कमेटी और एवं स्टेट और डिस्ट्रिक्ट लेवल पर टास्क फोर्स का, और मैं तो चाहूंगा कि ब्लॉक लेवल तक हम जितना जल्दी ये व्यवस्थाएं खड़ी करेंगे, और किसी न किसी एक व्यक्ति को काम देना पड़ेगा। रोजमर्रा के काम के साथ कोरोना से लड़ते लड़ते भी इस एक व्यवस्था को भी विकसित तुरंत करना पड़ेगा, ये मेरा आग्रह रहेगा।
The states listed their concerns during the meeting. Delhi Chief Minister Arvind Kejriwal blamed stubble burning in neighboring states for the sudden surge in COVID cases. He sought 1,000 additional ICU beds at hospitals run by central government in Delhi. Maharashtra Chief Minister Uddhav Thackeray urged Prime Minister Modi to stop political parties from staging street protests which lead to a spike in cases. West Bengal Chief Minister Mamata Banerjee sought release of GST dues to help states financially during the crisis. The Prime Minister advised the states to ramp up testing to get the new wave under control.
सबने अनुभव किया है कि आरटी-पीसीआर टेस्ट का अनुपात बढ़ना चाहिए। जो घरों में आइसोलेटेड मरीज हैं, उनकी मॉनिटरिंग ज्यादा बेहतर तरीके से करनी होगी। जो गांव है, कम्युनिटी के स्तर पर हेल्थ सेंटर हैं, उनको भी हमें ज्यादा इक्विप करना ही होगा। गांव के आसपास भी इंफ्रास्ट्रक्चर ठीक रहे, ऑक्सीजन की सप्लाई पर्याप्त रहे, ये हमें देखना होगा।
The Modi government has set a target of giving 30 crore Indians vaccine by September 2021. Right now, 4 vaccines are undergoing clinical trials in India, including Indian candidates, Covaxin from Bharat Biotech and Zycov-D from Zydus Cadila. The other 2 are the AstraZeneca Oxford vaccine and Russian-made Sputnik V. Both have claimed 90% or more efficacy in clinical trials abroad. With Paulami Saha in Delhi, Bureau Report, India Today.
So let's raise the big question. What should be India's vaccine strategy? Who will get the vaccines first? Do those who recover from COVID need vaccines? Can India produce enough doses of vaccines? How much will India's vaccine mission cost? Some of the questions that we will try and raise. I'm joined by a very special panel of experts. Joining me now is one of the country's leading virologists, Dr. Shahid Jamil. He's with also Ashoka University. Professor Ramanan Lakshmanan joins us. And I'm also joined, Lakshmi Narayan joins us, Director, Center for Disease Dynamics. And also Dr. Shashank Joshi, member of the COVID Task Force in Maharashtra. Appreciate your joining us. Dr. Jamil, I want to come to you because you've just written an interesting article where you've said while the news of the vaccine coming soon is encouraging, the devil remains in the details. Can you explain that to our viewers? What are these details that should worry us as we look forward to a vaccine possibly in the months ahead?
Well, when I was referring to the devil, it's the planning. Do we have a distribution plan ready in the sense that we know who to give the vaccine to when it comes? So what we are hearing is that vaccine will be first given to people who are on the front line. So, for example, healthcare workers and, sanitation workers, service people, and also people who have comorbidities and people who are elderly. What we haven't figured out is, will we give vaccine to somebody who has already been exposed? So that was really the question I was raising. If doses are going to be limited, should we not give it to people who have not been exposed? Because there's going to be no added benefit giving vaccine to somebody who has already had a natural infection. And certainly healthcare workers deserve the vaccine ahead of, first. But what if that healthcare worker has already had a natural infection? So to do that, we'll have to test. And the point I was raising is that if the test to find out antibodies cost the same as the vaccine, then economics will demand that you just blindly give the vaccine. And that is going to waste precious resource. So that's really the point that I was raising, that we need to really discuss this at the highest level, plan and have a strategy ready by the time the vaccine comes.
So let me get it very clear once again, Dr. Jamil. You're saying that those who have already been affected in the last several months may not need, in your view, the vaccine. They need not be priority, whether then they are frontline health workers or elderly or indeed the young. You're saying the focus should be on those who have not been infected. Am I correct?
Yes, because vaccine cannot beat natural infection for immunity. And if natural infection hasn't given you immunity, the vaccine is unlikely to do so. That's the whole point that I'm trying to raise.
Okay, that's an important point because Professor Ramanan Lakshmi Narayanan, I know you've been speaking about herd immunity for a long time. Now, let's assume that 60% coverage is needed for herd immunity. India would therefore have to vaccinate about 800 million people, assuming it's a 2-dose vaccine. That's about 1.6 billion doses. That's a lot of doses, even though a number of companies are in the race. Do you sense, therefore, that this process is going to be much longer than perhaps we are anticipating today?
Rajdeep, it's going to be longer for two sets of reasons. One is, although there's a great deal of optimism about the Oxford vaccine, and a lot of it is warranted, there are still open questions about that vaccine. First of all, we don't have all the data from the clinical trials. It's unclear why giving half a dose followed by a full dose a month apart gives you 90% protection, whereas giving a full dose followed by a full dose a month apart gives you only, 60% protection or 62%
62%,
protection.
yes.
Yeah, that just seems, it seems strange why that would be the case. So I think we're all happy, but I think we need to see details of this, and also in terms of two other important questions, which is, one, which age groups does it protect? If it only protects some age groups, we have some preliminary evidence apparently that it protects the elderly, which opens up another category, but we don't know if the vaccine is safe for children, which is an important question. So that immediately lowers the number of people that you can vaccinate with this vaccine at the current time. The second part is duration of protection. Now, let's say the duration of protection is only for 3 or 4 months or 6 months. That changes the equation quite a bit compared to a duration were lifelong or at least for a year. So although there's room for optimism, there are questions of this sort. The second part is really to do with delivery, as Shahid just mentioned, and here the questions are really around, one is affordability. Even at, say, 250 rupees, which works out to something like, $3-4 a dose, you're talking about, as you said, something close to about $8 billion for just the vaccine alone. Now that works out to roughly 48,000, if I have the numbers right. 8 billion is roughly what the government spends, the central government spends on health. So it's a massive amount of money, and there are going to be questions about whether the government should pay for everybody, or whether people above BPL or people above a certain income level can afford to pay for themselves, while we prioritize the vaccine for the poor who are unable to pay for themselves. So I think there are multiple lenses on prioritization.
Right.
The epidemiological lenses are some, but I think the equity lenses are going to be also very important, because we owe it to the poor to protect them against a disease that they weren't traveling to China or Italy. They need to be protected.
So what you seem to be suggesting is that the BPL families should get it free of cost, at least at the very outset. At least that commitment should be made. Remember, before the Bihar election, the government said everyone would get it free. Now, when the Prime Minister today was asked apparently by a Chief Minister about costing, the Prime Minister said that we haven't yet looked at that, nor have we looked at exact timelines. I'll come to that in a moment, because Dr. Joshi, one of the other things the Prime Minister said at the meeting today was apparently to the Chief Minister that you need to start setting up localized centers. This will have to be decentralized. Do you believe the fact that we've had so much of experience in dealing with polio campaigns in the past will come to India's aid? Do you believe we have the infrastructure today, Dr. Joshi, in states like Maharashtra, indeed across the country, to be able to ensure that this whole process gets expedited once the vaccine is there?
Rajdeep, that's a very good question, and I completely agree that we have probably the infrastructure and capabilities to vaccinate. We have been complemented both in the smallpox eradication program and in the oral polio eradication program by WHO. Remember, India produces world's half vaccines, and therefore I think we have, in pediatric space, we have clearly been leaders on planet Earth. Now, in adult space, we need a vaccine preparedness program, which has to be a very calibrated, scientific, science-driven, rational program. And I am reasonably confident that we will be able to execute it in a very logical, systematic way. Under the Niti Aayog chairmanship of Dr. Vinod Paul, we have a vaccine preparedness team, which has looked at it for the last 2 months and will continue looking at it and guiding the states so that this can be done. But the states will have to have its own infrastructure under the chief secretaries so that they can ensure the storage, the transportation, the administration, and the delivery of the vaccine to the right candidates and the right cohorts is done in a very mindful and a systematic way. And that is something which can be done. It is doable. We have had successes in other vaccine programs, particularly in polio, in smallpox, and many other vaccination programs. So I'm quite confident that we can do it.
But Dr. Jamil, as someone who's tracked this, is this very different? The challenge posed for a coronavirus, is that very different to the challenge that was posed, let's say, by the oral polio vaccine?
Absolutely. The oral polio vaccine came in a little vial, a little plastic bottle, and you put 2 drops on the tongue. This is going to come in vials, which will require a syringe and a needle. So it completely changes the dynamics. The polio vaccine could be given by any untrained person. An injection cannot be given by any untrained person. India's capacity to vaccinate is about 15 lakh doses a month. If you convert that into the number of doses that will be required to vaccinate 60% of the population, it will take 9 years for us to do that. So therefore, it is important that we build that capacity, we ramp up that capacity, and ramp it up pretty quickly. I mean, it's not
can you throw those numbers at us? Sorry to interrupt. Can you just throw those numbers, because I think viewers need to understand this. Can you just explain that? India's capacity, you're saying, is 15 lakhs doses per month?
That's right. That's the present capacity to vaccinate in the immunization program. That's 15 lakh doses a month.
Right.
And if you translate that into covering 60% of India's population, which is 800 million people, then you will take 9 years to vaccinate everyone at this rate. So it's not just the amount of vaccine that's available, it's also people who are trained to administer the vaccine, the logistics. The logistics are going to be incredibly more complicated than giving a pulse polio vaccine. India has done very well. I don't disagree at all. I mean, I'm actually very reassured that I live in India, which has this capacity to make vaccines and deliver vaccines in the last mile. But just because we did it for pulse polio, thinking that we can do it here, we need to take a very, very hard look at it. The dynamics are completely different.
Is that just one statutory warning you're giving us? Is there anything else, Dr. Jamil, that we should look at? Because, this general celebratory mood in the last week, I think needs to be tempered by realities, and you're giving us a reality check. Any other reality check that you want to give us today?
Well, the other reality check is going to be about the manufactured doses of vaccine. Certainly, India supplies the world, half of the world's capacity of vaccines. India makes roughly 3 billion doses of vaccines a year, out of which 1 billion is consumed internally and 2 billion is sent outside. If you look at the COVID vaccine manufacturing capacity, we are likely to reach about 60% coverage at this rate in about 2 years' time. So again, that's a reality check. Everyone should not think that they will get the vaccine as soon as it comes out. We are looking at the numbers of 3 main companies, Serum Institute, Bharat Biotech, and Zydus Cadila.
Right.
So that's roughly 800 million doses in a year.
That's right, because Serum says it's looking at 400 million doses. Of course, 800 million doses, of which 50% will be available for India, 300 million from Bharat Biotech, 100 million from Zydus Cadila. So the numbers are impressive, but as you say, it will take time. And I think that's one of the challenges. Also, in prioritizing, Dr. Joshi, you're part of the COVID task force in Maharashtra, and I'm told Uddhav Thackeray today at the meeting said he's already in touch with Serum Institute, which is Pune-based. But the worry is that are we aware of the logistical challenge that is required? Because even today we are first battling COVID virus. Let's be clear. There's a second wave or a third wave in some parts of the country. Do you believe that we have the logistics already in place, Dr. Joshi, or will it require time?
I think I'm the optimist of the group. I'm not as pessimistic as Dr. Jamil. I think we are in disaster times. We are not in usual times. What he's talking is in usual times when there are no pandemics. And during a pandemic time, India has capability, ability, as well as the infrastructure which can be ramped up overnight to manage this administration. The first thing which we need to look at is to look at the efficacy and safety of the vaccines on emergency use, whether in the interim results it is robust. And once that is there, then I think we have a preparedness plan in place which will be able to execute it in a very calibrated, systematic manner. I am extremely confident that in 8 to 9 months, we will be able to vaccinate a large cohort of the population. We can't make these predictions whether it will be 60% or 50%, but I think all the groups which need protection will get protection, and eventually the whole country will also get protection. That might take a little longer time.
Because, the Union Minister for Health and Family Welfare said that India will vaccinate 250 million people by 2021, which means 500 million doses, Professor Lakshmi Narayanan. Is he being optimistic or is he being realistic in your view?
If we are able to get the vaccine at the stated efficacy and the quantity that is being promised, I think it is doable. I certainly think that if we rely on our childhood immunization program, it's not going to happen, because pulse polio, you have to remember, is for 25 million children a year. And this we're talking about, 500 million. 20 times that number. But I would agree with Dr. Joshi that I think the government will pull out all the stops here in terms of delivery, and everyone will be focused on it in a way that we've never seen before. I think by 2021 it's possible. It will still not be enough to stop and get everyone vaccinated. There will still be some continuation, but I think getting 500 million people or the right people vaccinated will pretty much shut down a lot of this pandemic, assuming the immunity holds. So I'm just keeping my fingers crossed that the efficacy is as promised and we don't see a decline in coming months.
You know, Dr. Jamil, you know, what is troubling, of course, is the fact that, let me put it this way, what is one of the strengths, in a way, is the fact that we are now much more digitized. And therefore, there's a sense that the government can effect last mile deliveries, as we've seen with Jan Dhan Yojana, you know, ensuring people get their monies in bank accounts. Do you believe, therefore, that makes us better equipped today than we were 10 or 20 years ago?
Yeah, certainly it does. But, you know, you have to realize that at the end of the day, somebody has to take a syringe and needle in hand and go and vaccinate somebody. You can't do it online. So that's the trained manpower that has to be on the ground. And I'm optimistic that it will be there. I'm just sounding a cautionary note that that's a challenge that we have to live up to.
No, I think it's important to put these cautionary notes, Dr. Jamil, because my other worry, of course, and this is what I wanted to say earlier, is that, you know, those who have influence, well-networked individuals will make sure that they get vaccinated first. And those perhaps who are out of the sort of so-called influential set will find it more difficult. Is that something that should concern us or not? Dr. Jamil?
Well, I guess to some extent, but, you know, that sort of class attitude has been there in India all the time. I mean, you will hear people say, oh, you got the Bharat Biotech vaccine, I got the Pfizer vaccine. You know, it came through this channel or that channel. But let's not worry about that. I think we have a job at hand, and let's do it to the best of our ability.
Well, let's hope that that is the next big challenge that we look at. If 2020 has been the year where we've had to overcome the virus, 2021 is the year when our delivery systems will be tested. Can we deliver, distribute and ensure that the maximum number of people are vaccinated? I appreciate all my guests joining us on a day when the Prime Minister spoke to the Chief Ministers on this critical issue of vaccinations. Thanks all very much for joining me at this moment.